Good morning, everybody. It is 7 o'clock, tackling the tidal wave of Omicron with a plan to get the nation boosted. But will it be enough to stop a return to tougher restrictions in the new year? Can it be done? And will it help protect hospitals and prevent deaths? The Health Secretary, Sajid Javid, will be here very shortly, and we'll get Labour's view after 8 with the Shadow Foreign Secretary, David Lammy. We'll also speak to the Welsh Health Minister, who says new restrictions are likely there in the next few weeks. And
everybody's singing, dancing, getting in the mood. My pet Robbie's going mad, Nanny's drinking bubble bath.
Also this morning we'll hear from a musician, again using his talents to raise funds for a young boy in need. And wishing you a yappy Christmas. We'll speak to the owner of these adorable sausage dogs who are dressed up for a special occasion. It's Monday, the 13th of December. Call to jab arms. The Prime Minister sets sights on vaccinating some 1 million people a day by the end of the year in the race to beat the new variant.
No one should be in any doubt. There is a tidal wave of Omicron coming.
The South African president tests positive for COVID as the country records 18,000 new cases, the vast majority thought to be Omicron.
Desert Storm Mercedes to go to the International Court of Appeal after Max Verstappen denies Lewis Hamilton a record 8th F1 world title.
Police searching for a missing nursing assistant have found a body in this South London park.
The eye of the storm, the US president declares a major disaster in Kentucky after deadly tornadoes in several states.
Here in Kentucky, the governor tells Sky News that the community will be rebuilt. It will be supported as it recovers from the most horrific tornado.
I'm in the Ukrainian capital as the G7 warns of massive consequences if Russia attacks.
And the weather at home, stormy conditions are possible in the north this morning, but it will be mild this week with conditions settling down. Good morning, everyone. A tidal wave of Omicron is how the Prime Minister has described what's coming after revealing plans to offer all adults in England a COVID booster before the end of the year. That would mean jabbing around 1 million people every single day. Boris Johnson said if people don't get boosted, it risks a level of hospitalisation that could overwhelm our NHS and lead to very many deaths. The booking system opens to all adults from Wednesday, with some walk-in centres opening today for those without appointments. 42 military planned teams will help the NHS and thousands more volunteers have been called for. That's as the UK's COVID alert level was raised to level 4, meaning direct pressure on the NHS. Our political correspondent Kate McCann reports.
A fortnight ago, I said we would offer every eligible adult a booster by the end of January. Today, in light of this Omicron emergency, I'm bringing that target forward by a whole month.
An ambitious new target to tackle a new emergency. From today, all over 18s in England will have the chance to get their booster jab before the end of the year. The target moved forward by a month because of the threat posed by Omicron.
No one should be in any doubt. There is a tidal wave of Omicron coming, and I'm afraid it is now clear that 2 doses of vaccine are simply not enough to give the level of protection we all need.
Military planning teams will be brought in across the UK to support additional vaccine sites and mobile units, while clinics will extend their opening hours so they're open every day of the week. The Prime Minister has called for an extraordinary effort.
I think it's really important to get my booster. I want to keep myself, but ultimately my family safe as well.
The medical specialists say come and get it. I'll follow what they say. Let's do that.
The whole country just needs to get on with it and be careful. What more can you do?
The pressure now firmly on the NHS to deliver.
Of course, general practices across the country are involved, and lots of other allied healthcare professionals, nurses, and volunteers, pharmacies, and so on. So, I have great faith that this will be achievable.
Labour agrees.
This has got to be a big national effort. All of us have got a part to play. And it's crucial that, you know, despite people's anger and frustration with the Prime Minister, justifiable anger and frustration with the Prime Minister, we put that to one side in the effort to get the vaccine booster rollout and to make it a success.
The Prime Minister must make decisions to protect the NHS from Omicron without all the data, decisions that will affect all of our lives, decisions that many on his backbenchers will not support. And those political problems are piling up, questions about Christmas parties here in Downing Street, and a worry that the Conservatives could lose a key seat in a by-election later this week. The address was about convincing the country to support him, yes, but it was about getting his party's backing too. Boris Johnson knows he must prove his critics wrong. This week is the turning point. A reinvigorated booster campaign and a by-election win, the price of power. Kate McCann, Sky News.
One of the busiest men in the country joining us now, the Health Secretary, Sajid. Javid, hello, thanks for joining us. We really appreciate you taking the time.
Thank you for having me.
How many people a day do you want to vaccinate? How do they go about getting the jab? And will the centres be open through Christmas?
Well, thank you again for having me. Since we learned about Omicron, our strategy has been to buy time to assess it and to build our defences. What we now know about Omicron is that, first of all, that it's spreading at a phenomenal rate, something that we've never seen before. It's doubling every 2 to 3 days in infections, and that means we're facing a tidal wave of infection. We're once again in a race between the vaccine and the virus. The second thing that we now know for sure is that the vaccines, 2 doses are not enough, but 3 doses still provide excellent protection against symptomatic infection. And that's why the booster programme has become more important than ever. We've boosted more people than any other country in Europe already, but we now need to go on a new national mission, and that's what we're doing. That's what the Prime Minister announced yesterday. We are extending and opening the booster programme to all over 18, starting from today in walk-in centres. They can book for Wednesday to give them all a chance to get their booster shot before the new year. And the way we're going to do this is by expanding it to a level, the booster programme, that we've never seen before in terms of vaccination in this country. So we're going to have even more vaccination centres. We're going to open all vaccination centres 7 days a week for at least 12 hours a day, some for many, many longer than that, some even perhaps 24 hours. Over the Christmas holiday period.
They'll be open every day?
I'm not sure. I don't think they're going to open on Christmas Day at this point.
Every other day?
They'll be open. The current planning is to open them every other day.
1 million people a day?
Well, let me tell you how we're going to do it.
Well, that's how many you'll need to vaccinate.
We'll have to look. The target is huge. Of course, it's a huge target.
What is the target?
The highest we've ever achieved before with the vaccination programme is around 770,000 in a day. Yeah, in terms of vaccinations.
540,000 with boosters.
With UK, we've achieved 770,000 before. That's the highest in a single day in England before. And so to try to boost this many people, you're going to have to even beat that every single day. Now it's a phenomenal target and the phenomenal thing we want to do, but it will only work if, of course, we've got the capacity there, and that's why we're building this capacity, including different types of units, mobile units and pop-up units, asking GPs to do more and pharmacists to do even more. We've brought in 41 military planners covering every region in England to help with the logistics and the planning, working with all the fantastic people in there. We are throwing everything at it. And can I just please say this to your viewers, that please play your part. This could not be more important. We need to win this race against the growth of this virus. As I say, we've never seen this kind of growth before. So please do come forward, protect yourselves, your loved ones and your community.
Is it because AstraZeneca wasn't as good as we initially thought, and actually the booster, either Pfizer or Moderna, is what's helping?
No, I think that would be completely unfair. AstraZeneca has played a phenomenal role in protecting our country. So that's the accusation, so you're saying... No, we remember we were one of the first countries in the world to start vaccinating. That has meant that we have slowly started. We saw this especially over the summer. We started opening up. We are still one of the most open countries, and because of the success of our vaccination programme. And AstraZeneca has played a phenomenal role. Okay. The difference now is this variant, and different types of vaccines will react in different ways. But whether it's AstraZeneca you had for your first 2 doses, or it's Pfizer or Moderna, you still need a booster shot to be protected against this new variant.
How many people are in hospital with Omicron this morning?
It's around 3,000 confirmed cases in England.
In hospital?
I'm sorry, I beg your pardon. I misunderstood your question. Cases is around 3,000. In England, there's about 10 people that are confirmed in England with Omicron.
How many are on ventilators?
I don't have the answer to that question. I don't know how ill they are in hospital.
How many have died?
At this point in time, I can't confirm a death. But just can I say that even with the...
You see where I'm going with this?
I absolutely do. And the key point is that first of all, if you remember when COVID first came to our shores, it arrived in January of 2020. We didn't have our first death until March, I believe. And the reason is because there's always a lag between infection and then hospitalisation, and then sadly death. There's always a lag, and that's what we're even in South Africa, where this variant started earlier. There's been a huge number of hospitalisations. They've been doubling.
That's levelled off already, though, hasn't it? And fewer people are now finding themselves on ventilators in South Africa, and even the Prime Minister or the President, who's sadly been confirmed with Omicron, he only has mild symptoms.
Well, there's a lot of talk about this might have, it might be less severe, so milder. The truth is, no one knows for sure at this point. It's very difficult to compare what's happening in South Africa to what might happen here. For example, differences in the age of the population, the different levels and types of immunity people have, how they gained that immunity. But it might we can't rule it out. It might be more milder than the Delta. But what the difference that there exists is that the growth rate is what's different. And so if it grows at such a phenomenal let's say 1 million infections at the current growth rate by the end of this month, even when a virus is mild, a small percentage of people from a very large number still can equal a high number of hospitalisations.
75,000 deaths by May is what the London School of Hygiene and Tropical Medicine is modelling. They have previously done modelling. They forecasted in April that we would suffer post-lockdown, predicted 750 to 1,000 deaths a day by the end of summer 2021. That actually resulted in something like 71 deaths a day. So how seriously can we take their figures?
Well, look, those are their figures, and
that's what they were modelling on, isn't it?
No, it's not at all. Not at all. That's their figures. They don't work for the government. They're an independent group. We will get our own advice from the government's own scientists, and we listen carefully to that advice. And at the end of the day, as ministers, you have to take all this into account and understand the trade-offs, because when you do take action, like we've asked people to work from home from today, this has a big impact on people's lives. It's not just a distraction. It can be really difficult for people to be away from the office, not to have that social interaction. It can impact their life chances. So we wouldn't take this action lightly at all. So based on the advice that we're getting, but now also on the observed data, we do have 2 weeks of data where we are seeing this phenomenal growth in infections. It's already, we estimate, it's around 40% of infections in London already. And so because of this growth rate and what we now know of the vaccines, that's why we've announced this national mission on the booster programme.
Let me put this to you, if I may, please, Health Secretary. The Prime Minister said last night, he's put the fear of God in us. Do not make the mistake of thinking Omicron can't hurt you, can't make you and your loved ones seriously ill. That's what the Prime Minister said yesterday. You're telling me this morning we've only got a handful of people in hospital with, let me finish, with Omicron. As far as you're aware, probably none of them on ventilators. Certainly nobody has died. We have been aware that this Omicron variant has been in the UK since October. So that gives us 3 months of data, and there have been no deaths.
Well, as I say, the Omicron has only taken hold in the UK in the last 3 weeks. It's already growing at a rate of doubling 2 to 3 times. Every 2 to 3 days, it's doubling. And we are, at that rate, you will have 1 million infections by the end of the month. And what that means is that even if the severity... So let's think of it this way, Kay, if I can explain it this way. With Delta, let's assume that of all the infections, around 2% of those people end up in hospital. With Omicron, let's assume it's half the severity. It's half the severity. Let's just half it. if it's 1% of a much larger number, you still end up in a lot of hospitalizations. And what the government could do, you know, there's a couple of options here for any government,
been any deaths,
right?
Minister?
Well, there haven't been any deaths yet.
Yes, but we've known about it being in the UK since October. And
well,
it's
only
3 months, and there haven't been any deaths yet.
What matters is when community transmission starts, and that's only been actually probably 3 weeks at most in terms of community transmission. That's what we've started to see in this country. And if the government just sort of stuck its head in the sand and said, let's just wait and see what happens, let's wait for the deaths to happen, by then it would be too late. The infections, the growth rate for certainly the next couple of weeks would have been baked in, the doubling times for the next 3 or 4 doubling times would have been baked in. And then you'd have me here rightly saying, why didn't you act earlier? Why didn't you act earlier? Have you not learned any of the lessons about this virus? Have you not learned about how to try to protect people from it and to take action in advance? And you would have rightly have been able to ask me those questions.
OK.
But we've got to act early, and that's the reason to have this booster programme expand at the pace that we wanted to see it and ask people to please come forward and to protect themselves.
OK.
It's the best way still to protect ourselves.
Given that it's here, are we going to lift South Africa off the red list?
We'll keep that under review, but as it spreads across the country, there's obviously less and less reason to put any country on a red list because of Omicron, but we are keeping it under review. OK,
let me talk to you about Downing Street and what's going on there, if I may. You were too upset to come in last week, weren't you? I understand that when you were looking at that video. How are you feeling about it now?
Well, it's being investigated. I'm pleased it's being investigated properly. It's being properly looked at.
Labour demanding that the Prime Minister answer questions in the Commons, not just about that video, but about a quiz that he hosted as well. Is that something that the government should comply with?
Well, look, I saw the photo of that quiz like anyone else. What I can see is it's a virtual quiz with the Prime Minister sitting at his desk. But again, the Prime Minister...
Who was he talking to on the quiz?
I think he's talking to some of his staff on a virtual quiz.
And where were they all? They were all in the same room. So, you know, it's duplicitous to say he was
I don't know all the details. What I can see it's a virtual quiz, and Simon Case has been given a broad remit to investigate anything that he thinks that should be under any type of gathering in Downing Street that should be looked at on any particular day he wants to. And so if he wants to look at this, he will. That's going to be a decision for him. It's not right, I think, for a minister to tell him what he should or should not investigate. He would have seen that photo, I'm sure, himself. But let him do his job. And it's right that it's a cabinet secretary that does this, that's a civil servant, a senior civil servant, and that's the right way to try to establish all the facts.
But in order for that to have that investigation to have any credibility, it needs to report this side of Christmas, doesn't it?
Well,
it does. Otherwise, you're kicking the can down the road.
Well, I think Simon Case will determine for himself how long he needs to establish the facts and to look at the evidence. And I'm sure if he can publish it sooner rather than later, he will. There's no reason not to.
Whatever, the polling is poor as a direct result of what's been happening with the Prime Minister. How important is Thursday's by-election to the Prime Minister?
Look, every by-election is important. Of course, we want to win it. We're in there to fight for every vote. We're lucky we've got a fantastic candidate. Neil Shastri-Hurst, he's worked in the NHS, he's worked in the army, and he's a fantastic candidate. And I'm sure anyone in Shropshire that meets him will like him. But ultimately, it's about fighting for every vote.
Yeah, the bookies, and as my dad always used to say, I've never seen a poor bookie, are saying the Lib Dems are going to win.
Well, let's see what actually happens.
What impact will that have on the Prime Minister and the respect that he has from the party if he loses?
Look,
given that you have
any party wants to win any election, whether you're in government or not. We want to win this election. We won one just recently, and we're going to work hard and fight for every vote.
We're out of time, but let me just ask you whether you saw Lewis Hamilton's race yesterday.
I did not. I didn't have the time.
I
did read about it. I just didn't have the time. I was working on expanding the booster programme.
Indeed. Are you an F1 fan?
I'm not normally, but I did watch it last week, and I really wanted to watch it this time. But
you should watch it back. It's an absolute outrage. Some might say, not that I've got any influence at all. But yeah, it was
I felt sorry for him. I'm a real fan of his. And also, by the way, he's just done a fantastic video with other Formula One players, encouraging everyone to come forward and get vaccinated.
Good to talk to you. Thank you very much indeed. I know you've got a very busy schedule today. Thank you. And indeed, this side of the new year.
Thank you.
Much appreciated. Thank you. Let's have a look at what's happening as far as the papers are concerned. The Guardian's headline, PM bets on 1 million jabs a day to halt the tidal wave of Omicron. Oh me God is what the Sun is saying this morning, front of the paper, as they also lead on Boris Johnson's turbocharged approach to the booster rollout. The Mail describes the new plan as ambitious, with the Express conveying as sense of emergency with their headline. And the Metro reports on a record-breaking day yesterday with just over 500,000 boosters being delivered. However, given the maths to achieve the 1 million a day needed, this would mean almost doubling efforts for the next 18 days. While the South African President Cyril Ramaphosa is being treated for mild symptoms of COVID after testing positive, it comes as the country recorded more than 18,000 new confirmed cases yesterday. More than three-quarters are thought to be from Omicron. John standing by for us in South Africa, in Johannesburg this morning. Hi, John. How's he doing?
Morning, Kay. Yeah, he is said to be in good spirits this morning down in Cape Town. Symptoms are not too bad, we are told. He was delivering the eulogy yesterday at the memorial service for the last president of the apartheid era, F.W. de Klerk, and words started to filter out that he wasn't feeling that great. He went and got a test, tested positive. And he's been put into self-isolation in Cape Town. He's handed over the reins of power to his deputy, and they released a statement asking South Africans to go out, get a vaccination. That has been an issue here. Only about a third of the population have been fully vaccinated. But he is just a small part of this huge fourth wave of infection in this country. As you said, 18,000 new cases registered by the authorities yesterday. But so far, this wave, and the vast majority thought to be Omicron, so far this wave is generally proving to be manageable at the moment. Most people saying that their symptoms are mild. People in the hospitals say that the number of people with the most severe symptoms are quite small in comparison to the previous three waves. They have very few people relatively in ICU, relatively small numbers of people on oxygen, on ventilators. So at the moment, it's proving manageable for South Africa.
Police searching for the missing nursing assistant Petra Srnakova have found a body in a park in South London. Milena is there for us, in Camberwell actually, in South London. Hello to you, Milena. Good morning to you. Tell us more.
Good morning, Kay. That's right. Police were called to this park in South London on Sunday by a member of the public. They are no longer here on site, but you can see there's some tributes left for Petra Srnakova, flowers and candles. Now, the body that has been recovered here has not yet been formally identified, but Ms. Srnkova's family in the Czech Republic have been notified of this development. The police said, additionally, the Czech Minister of Foreign Affairs has also tweeted that their embassy here were notified by the British police that the body of a missing Czech citizen has been found. Now, at this stage, the police say that this death is being treated as unexplained, and the man who had earlier been arrested in connection to Srnkova's disappearance has been released on bail on Sunday.
OK, thank you. The US President Joe Biden, let's talk about him. He's declared a major disaster in Kentucky after deadly tornadoes in several states. The official death toll, 48. But rescue workers are still searching through debris after what could be the longest tornado path ever recorded in US history. Well, our US correspondent Mark Stone travelled to Kentucky and spoke to residents of Mayfield. From there, he sent this report.
In this Kentucky community, resilience and faith run deep. Sunday worship is at 11 a.m. every week, and it was on this day too, for a congregation who survived in a church that's still standing. But beyond the First Baptist Church, Mayfield is devastated. Businesses, homes, lives destroyed. On every corner in the heart of this town, they are picking up what's left. The tornado cut a path right through the centre, whipping up everything. On the corner of 6th and North Street, it is all too much for Elise Ray.
I've been through the town a couple of times and saw everything, but it's just upsetting, you know, to know that that's the town that you grew up in and everything, you know, his memories is all gone.
The building is what's left of her local law office, and the owner is David Hargrove.
It looks like you're still at your desk trying to clear up, and you still got a smile on your face.
Yeah, well, you know.
That's resilience.
Yeah, you smile or you cry, and you don't have much time for tears. You know, I've had them.
Even the buildings which are still standing here have lost their roofs. The tower of the historic courthouse was toppled.
It really is an overwhelming experience here, block after block, such extraordinary destruction. It will take them a very long time to recover from this.
A block away, we ran into the state governor.
A lot of people need a lot of help. We've seen so many different communities that they're really struggling.
Now, we open our homes for each other. We're going to make sure that we're fed and we're going to rebuild. We're going to make it, but we are grieving people today. Thank you.
The rebuild he's pledged will take time, it will cost money, and all of this will stir the fractured politics here too. On the edge of the town, beyond the roadblock, the cost of it all in lives. The candle factory was where for 2 days and 2 nights now they've been searching for survivors. More than 100 people were working the night shift here on Friday. Hour by hour, good news seems less probable. At the church, they're carried by faith, but they will need more than that. The help was promised, it will come, but for now this is very much a community struggle. Mark Stone, Sky News, in Mayfield, Kentucky.
And of course, we will continue to monitor that for you. Meantime, let's take you into the eye of the storm now. Have a look at these pictures now. Wow, it looks black to start with, doesn't it? And then there's a lightning bolt, and you can see. Can you imagine if you were on your porch and you saw this coming towards you and you didn't have a basement in your house? What do you do next? Sadly, some people have lost their lives as a result of this storm heading their way. Oh, my goodness me. That would put the fear of God in you, wouldn't you? Let's tell you about meteorologists saying it could be one of the largest tornadoes in US history. The chef, Jose Andres, has also mobilised a team of food trucks to support those who have been affected.
We have some of the food trucks already on their way there. They should be arriving in the early hours of Sunday. And I'm going to be joining the teams tonight to make sure that, we show solidarity with the many people that during these holidays, this Christmas season, unfortunately, are going to be going through a very hard time on top of everything else going on with COVID. So I will report more once I'm there, but I always said that wherever there is a fight, so hungry people and people in need may eat, that we will be there.
Oh, thoughts with those families out there just at the moment, and the search and rescue operation is continuing. We'll update you throughout the course of the day here on Sky News. Quick look at the weather here.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
After a very windy weekend, the weather shows signs of settling down in the week ahead, and it remains on the mild side. Stormy conditions are possible in northwest Scotland and the Northern Isles this morning, with a risk of coastal gusts briefly exceeding 90 miles an hour, along with some squally showers.
The weather, sponsored by Qatar Airways.
Now, have a look at some of these images that we've got for you this morning. This is from the Greek capital in Athens. As we all know, there is only one Santa Claus, but that's never stops people dressing up just like him. Hundreds did so in the Greek capital for a festive fun run, all to raise money for charity. They made their way around the 2-kilometre course, which included some of the scenic sights of Athens, including the Olympic Athletic Centre. There was beautiful weather for it, as you can see. They were running in a wonderfully mild 18 degrees, a lot warmer than where the real Santa Claus lives, of course. Do you recognise who this is? Have a look. Oh, OK, we're doing them full frame. There you go. Do you know who that is? Yeah, there you go. It is Eddie Redmayne, this morning reviewing the classic Candour and Ebb musical, in which Mr Redmayne has the look of a cherub gone to seed. The revival received 4 stars out of 5 from critics. Also from The Times, meet the women with the world's largest collection of Harry Potter memorabilia. Health Secretary has confirmed to us that around 10 people have been hospitalised in England with the Omicron variant 10. Sajid Javid says we're in a race between the vaccine and the virus as the booster programme is expanded to all adults. But Mr Javid was unable to confirm whether anyone had died from the Omicron variant or indeed if they were on a ventilator.
In England, there's about 10 people that are confirmed in England with Omicron.
How many are on ventilators?
I don't have the answer to that question. I don't know how ill they are in hospital.
How many have died?
At this point in time, I can't confirm a death. But just can I say that even with the...
You see where I'm going with this?
I absolutely do. And the key point is that first of all, if you remember with when COVID first came to our shores, it arrived in January of 2020. We didn't have our first death until March, I believe. And the reason is because there's always a lag between infection and then hospitalisation and then, sadly, death.
Ali is here. I suppose some of our viewers might be a bit surprised by those numbers this morning. It's the first time we've had numbers about the impact of Omicron.
Yeah, that's right. So he's very stark on how quickly it's spreading. He said it's like something we've never seen before. But as you say, he confirmed 10 hospitalisations and that he wasn't aware of any deaths yet. But he said that the government had to learn from the lessons of the past, and that is why they are acting now. He said it'd be wrong not to do that. But I think the challenge is also going to be getting people on board with this. And he said himself that people have a part to play too in the booster rollout. But we know it's been a really difficult few weeks for the government, dogged by those accusations about Christmas parties. And you rightly asked him about that today. And he pointed to the Simon case, the Cabinet Secretary investigation, which is quite an easy line for the government to take. You asked him when that's going to come back. Is it going to come back before Christmas, which I think is what a lot of people want to see. He said, hopefully sooner rather than later. But I think a lot of people are going to be looking to that by-election on Thursday, which he said they're working hard on. But as you put it, a lot of the polls are not particularly favourable for what is a Tory heartland seat, a rock-solid Conservative majority. So if they lose that, that would be very difficult.
The bookies say they will. If they do, to the Lib Dems, we don't know yet. We'll find out by Friday morning. If they do, what impact will that have on the Prime Minister? They're gathering, aren't they?
I think that will be a huge upset in a by-election if that did happen. I still think that's not necessarily what will happen. But as you say, the bookies are saying that the Lib Debs are creeping in. And we are seeing a real anger on the backbenchers. We have a vote tomorrow on the COVID restrictions, and we think about 70 or so backbenchers could rebel on that, the biggest backbench rebellion since Boris Johnson has been Prime Minister. So people are circling. And I think this is a transactional relationship. They know that Boris Johnson does well at the ballot box. If he doesn't prove that that is still the case on Thursday, then people are really going to start thinking
the revenge potentially of Theresa May. We'll talk about that in your take at 9 o'clock. Thanks so much indeed, Ali Finai. Thank you. Let's take a look at the latest COVID data, should we? It looks something like this. 48,854 new cases of COVID-19 recorded in the last 24 hours. Another 52 deaths have sadly been reported within 28 days of a positive test. That brings the total number of deaths in the UK to 146,439. To the vaccine rollout, more than 25,000 people received their first dose of a vaccine. 36,000 have had their second dose. That means the total number of people to have received their second dose, 46.7 million. And more than 500,000 people have received their booster. That's their third vaccine, and that's in the last 24 hours, bringing the total to more than 23 million. But does that need to increase to more than 1 million people a day in order to get as many people as the government wants boosted by the end of the year as possible. It's going to have to be 1 million people a day. They have mobilised the army. Will that be enough? He also said that all of the vaccine centres will be open on every day apart from Christmas Day, he said. Vaccine passes become law in Northern Ireland today. They'll be needed for entry into pubs, licensed restaurants and other venues. In Scotland, new self-isolation rules have come into effect. And the Welsh Health Minister says new COVID restrictions are likely to be introduced to curb the spread of the new Omicron variant. The Welsh Health Minister joining us now, Baroness Morgan, of course. Hello to you, Baroness. Thank you for joining us on the programme this morning. How concerned are you in Wales about the Omicron variant? How many people are in hospital in Welsh hospitals this morning as a result of Omicron?
Well, thankfully, we're still at the very beginning of this wave in Wales. We only have 15 cases, but clearly we know that there is a huge tidal wave coming towards us, and we're doing all we can to prepare for it, obviously by trying to get as many boosters into people's arms as quickly as possible. We've got a huge programme on now to try and make sure that we can deliver as many vaccinations as possible. That booster, we know 2 vaccinations is not enough, that you do need the booster dose, and that's why we're asking people to step forward to understand the seriousness of the situation.
What does that tsunami look like? What is it that we're most concerned about?
Well, it really is a case of numbers. So we're expecting the wave to reach its peak probably mid to late January. And that's why what we're trying to do is to make sure that we can get as many boosters into people's arms before it hits. That's going to be a really difficult task. And our teams have been working all weekend to see how quickly we can roll out that booster programme. We've already got plans to vaccinate 1.3 million additional people. But the question is, can we roll that forward now and see if we can give that protection as soon as we can?
We are very thankful to the scientists in South Africa for discovering the Omicron variant. They are telling us that it looks on balance as though it is much milder than the Delta variant. Fewer people finding themselves on ventilators in hospital, fewer deaths as a result of the Omicron variant. What's the situation in Welsh hospitals? How many people are in hospital?
Well, we've got 1 case in hospital, but we are expecting this to change very quickly. What we're concerned about really is the numbers. So if we see a situation where we literally have hundreds of thousands of people who are ill from the Omicron variant, it doesn't mean that they're necessarily very seriously ill, but the numbers of people who will be off work will bring real pressure on our public services, in particular, of course, our NHS, at a time when the NHS is stretched to its limit already. And then, of course, you only need a few people if you've got vast numbers of people.
Baroness, I'm sorry to interrupt. We only have a limited period of time. So you're not concerned necessarily about the number of deaths. You're more concerned about people being off work ill and, as a result, the impact that is going to have on the services.
No, proportionately, we're still looking at the data in terms of whether people get seriously ill with this. But if a small number of people getting very sick from a large number of people with Omicron means that you can fill your hospitals up pretty quickly.
Baroness, thank you very much indeed for the clarification. Much appreciated. Thank you. Let's talk about Russia and Ukraine. Tensions simmering there as satellite photos show more and more Russian troops gathering at the Ukrainian border. Let's talk about it in more detail with our security and defence editor, Deborah Haynes, who is in the capital, Kiev. Hello to you, Deborah. Good morning. This is getting very tense.
Well, it is, and in a sign of the concern being felt by Western allies. You had that meeting of the group of 7 developed economies over the weekend, their foreign ministers, and they decided to issue a separate statement purely focused on the Ukraine issue, warning of these massive consequences and severe costs for Russia should an invasion happen. Well, here in Kiev, yes, they are worried about the potential of all these tens of thousands of troops amassing at their border, launching fearing some kind of new military attack. But they're also suspicious that actually maybe the intent of Vladimir Putin is to use his military forces as a way to gain leverage with the West for diplomatic discussions that would then allow him to have international recognition for territory that he's already taken. So tense times, and I guess the next few weeks we'll see which way this is going to go.
Hey, Deborah, thank you. Thanks a lot. From today, the government is advising that all who are able to work from home should do so, as scientists fear a wave of Omicron will hit the UK. But what does this mean for businesses, especially those that rely on workers heading to offices around the country? Well, let's speak now to Beatrice Pallister, who owns Juju's Cafe in Birmingham. Hello to you. Thanks for joining us. How worried are you about people working from home? What impact will it have on your business?
Honestly, already after the announcement, the morning after, we lost a quarter of our Christmas bookings. So they were mainly corporate bookings, obviously people that aren't going to be in the office anymore. And it was absolutely heartbreaking. It's devastating because all of our ingredients are, ordered. We've paid for all of our turkeys up front. So they're coming whether our guests come or not. So we're in quite a tricky spot at the moment.
What can you do? Where do you go from here?
Well, we're rallying round. All of our regular customers who live nearby are coming for a turkey roast, which is great. We're trying to fill the bookings, but I mean, at the end of the day, we've got to accept it. There is going to be some kind of a loss in, the part of the year when we should be making enough to cover the first quarter of next year, which is notoriously difficult in hospitality. So we'll just have to try our hardest and cross our fingers. Hopefully we'll pull through.
It's been so challenging, hasn't it, Beatrice, over the last 18 months or so? What would you like to say to the government this morning?
I think they need to be consistent with their messaging. There should be one rule, for everyone. We've heard rumours about parties, etc., in Downing Street. And for me, potentially facing the loss of my livelihood. I've worked here since I was 13 years old with my mum. I've known my staff for over 10 years. So yeah, it would just be absolutely heartbreaking if this was to be the end of us. And yeah, I'm pretty angry. I understand the need for the new restrictions, but I just think that the message of saying, do go to your Christmas party, but don't go to your office, is quite contradictory. So I just hope that if there is another lockdown or anything else coming, there would be more financial support for businesses like us.
Okay, it's good to talk to you. Fingers crossed that this will be more or less the end of it and you can start to pick up again next year. Thanks a lot, Beatrice. Thank you.
Thank you.
Thanks. Let's speak to the owner of Need a Cab, a taxi firm in Plymouth and Exeter. That's David McIntosh. Hi, David. Thank you very much indeed for joining us. How have you been impacted?
Well, we've got to look at options now of possibly allowing people to work from home. We're very telephone orientated. We've got a booking app like most companies have, but we are looking at introducing new training for people. The problem we've got is you've got a local authority down here who are actively engaging with people who are advertising on social media, providing taxi services, which is totally illegal. They're not insured, and it does present a serious public safety problem. You've also got the obscene and abusive language that telephone operators are subjected to. Now, I don't want someone being at home with their children in the background hearing that sort of language being used. We do our best. We get as many taxis as we can. As you know, there's a national shortage of drivers. So we do what we can when we can, but the amount of abuse that our staff are receiving is just unbelievable. It really is disgraceful.
I'm guessing that's the level of frustration from people who are trying to get a cab and can't.
Yeah.
How difficult is it to retain drivers?
We've had to do things like introduce incentive schemes for drivers. Not something that we were going to do anyway, but it's brought it forward. It's the way you treat the drivers. If drivers are treated well, they stay. Good drivers don't normally move offices. So we try and make sure that we look after our people very, very well, and that encourages them to stay. The biggest problem we got at the moment is the recruitment. We work very closely with several of the job centres around the area, because a lot of good people, because of the pandemic, have lost their job through no fault of their own, and they're looking for another income. So we're encouraging people to look at taxiing as an option. It is a good job if it's done well.
And what would your message be to the government this morning, Dave?
I think they've got to be consistent. I mean, the poor lady in front of me, on before me just now with a restaurant, you know, it actually affects the whole hospitality industry, because people have got to get there and get home. So I'm sure that some of her bookings were down because the lack of drivers means that people aren't confident in going out in the evening and getting a taxi home at the end of the night. So it either means someone goes as a sort of designated driver for the evening, which affects their night out, or they don't go out at all. And I think a lot of hospitality places, pubs, clubs, restaurants, are finding the bookings are down purely and simply because people are frustrated because of the lack of opportunity to get a taxi home at the end of the night.
OK. Dave, good luck. It's a challenging time. I understand. We appreciate you taking the time to join us this morning. Thank you.
You're welcome. Thanks very much.
Thanks a lot. Coming up on the programme, we're going to be having more on the plan to get boosters into the arms of eligible adults by the end of the year. I was pressing, actually, the Health Secretary this morning to ask him how many people a day need to be vaccinated in order to get those boosters up to where they need to be by the end of the year. He didn't want to be pushed on that, but our calculation is that it's about 1 million people a day. We're not at that now, but he did say that walk-in centres will be open for everyone from tomorrow, and that those walk-in centres and other ways of getting your jab will be open every single day between now and the end of the year, apart from Christmas Day. I asked him how many people are in hospital with Omicron, how many are on ventilators, how many have died. Stay tuned and find out.